Hello, I'm Dr. Jennifer Klemp. I'm a professor of medicine in the Division of Medical Oncology at the University of Kansas Cancer Center, and I also work with Caris Life Sciences. Some of the highlights from ASCO Survivorship that I focused on today really dealt with risk stratification in cancer survivors, being able to identify those at highest risk. And I think one of the biggest tools that we don't use enough is doing some sort of geriatric or frail assessment. So we highlighted some of those tools that are out there and how they really can help us identify patients who may have higher costs for hospital utilization, emergency room visits, and really have more needs both during and post their treatment. If we can integrate these types of tools into practice, I think we're going to be able to really manage those at highest risk better and hopefully reduce some of those costs and the intensive nature of those patients. But really thinking about it not just from the frame of being 65 or older, but really from the frame of a frail patient in your practice. Another kind of angle for risk stratification looked at some of the risks for cardiotoxicity and cardiovascular disease. I think it's once again very important to have that assessment done at baseline so we can educate, intervene, and sort of mitigate those symptoms instead of once again sort of always playing catch up. We know that our patients who are at high risk for cardiovascular disease also, once they go through cancer treatment or live with or through their cancer treatment, can be at accelerated risk for cardiovascular disease, both with earlier onsets and obviously things that may not be reversible. So it's really important to identify those patients early and to be able to assess them on an ongoing basis. And then lastly, I think the important piece is to think about some of the complementary alternative tools that our patients are using, from cannabis to acetaminophen to acupuncture. One of the studies highlighted, potentially the conflicting sort of relationship between acetaminophen and immune checkpoint inhibitors. And then we looked at some of the benefits of things like cannabis, medical cannabis in particular, and acupuncture. We need more studies, we need randomized trials, and we really need to be able to see, what the genotype and phenotype is for patients who benefit from some of these complementary therapies that our patients are already using, and we really need to know their safety and efficacy so we can better manage our patients both during and post-treatment.